Hello everyone, I am Dr. Siddharth Mittal and today we will be discussing about serological techniques in evaluating blood groups and various issues. Before going to the main topic, we should first know the importance of blood grouping. Blood grouping is the foremost mandatory and essential test before transfusion of any blood component to a patient, be it packed red blood cell, FFP, cryoprecipitated or platelets. Blood grouping is essential. Also, blood grouping aids in the diagnosis of clinical conditions like hemolytic disease of newborn, in which neonatal RBCs are destroyed by maternal antibodies transferred to the placenta. The most common cause of this disease is first Rh antibodies followed by ABO antibodies. And in both conditions, we need blood grouping to find the blood group of mother and the neonate for clinching the diagnosis. Also, blood grouping has been used to resolve paternity issues as it follows Mendelian pattern of inheritance. It also has a role in medical legal cases, and nowadays many diseases have been found to be associated with various blood groups. For example, in COVID-19 pandemic, many studies found out that people with A blood group have much more severe disease and infection clinically as compared to people with O blood group, and in fact O blood group offers some kind of protection against COVID-19 virus. Moving on, we should know the Lansdale law, which states that if an antigen is present on the red blood cell of an individual, then the corresponding antibody will be absent under normal condition. Simply stated, if an antigen like A antigen is present on the red cells, then the antibody in the plasma will be anti-B and not anti-A. Similarly, in individuals with B blood group, the antigen on the RBC will be B and antibody will be anti-A. The next figure depicts the Lansdale's law only, and it shows that people, group A individuals have A antigen on red cell and anti-B. Similarly, group AB will have both antigens on the red cells, however no antibody in the plasma, and group O individuals will have both antibodies in the plasma anti-B and none of the antigens on the red cell. Moving on to the platforms of blood grouping, we can divide them into serological, molecular, antibody sensors using synthetic and natural antibody sensors, blood test kits which uses lateral blood flow assays. Among serological, we have various techniques like slide method, tube method, microplate assay, column agglutination technology, solid phase technology, and erythrocyte magnetic technology. We'll be discussing each assay in detail onwards. The first method is slide or tile method. It was the most initial method which was used for blood grouping. Nowadays, the only use of this method is for emergency OB grouping like trauma patients, in which we cannot receive a sample of the patient in the blood center. Then we can go to the bedside of the patient, collect a sample from the fingertip and do the blood grouping at the patient's bedside. It is also being used to find the preliminary blood group of an individual in outdoor camps. However, slide method should not be used for routine testing because it is not reliable for weak antigen and weak subgroups of ABO. It causes a greater risk of exposure to infectious samples. Drying usually takes place very quickly after the agglutination on a slide method and can lead to false interpretation of a negative result. It also is not suitable for detecting antibodies in the serum of an individual. That means it cannot be used for reverse grouping, and the results of a slide method should usually be confirmed by tube or microplate method or any other serological technique. It's very simple to perform. We just take a slide, make 3 circles using a sketch pen and label them as anti-A, anti-B and anti-D. First, anti-sera has to be added always, followed by the sample of the patient or individual, and then we observe for agglutination by rotating the slide side by slowly in a circular motion or using a plastic tip, and then we record the agglutination. Moving on to the next method, tube method. This is the recommended gold standard method which is used in for blood grouping in most of the blood centers. It allows for longer incubation and has no drying effect and therefore gets better result. Also, the test tubes can be centrifuged to enhance the antigen-antibody interaction. The main two methods are spin tube method and sedimentation method. For both in spin tube method, we take the help of a serofuse or centrifuge And in sedimentation method, after mixing of patient red cells and antisera, we allow them to stand at room temperature, and by the gravitational pull, the red cell and the antisera will settle at the bottom of the test tube. Usually what we use is spin tube method with the help of which takes the help of a centrifuge. Test tube method can detect weak antigen as well as antibodies. The two steps are forward grouping and reverse grouping, which I'll be discussing further. And the principle is Hemagglutination assay, in which antigen antibody reaction takes place, and Hemagglutination or hemolysis is the endpoint. So we take a rat, we label test tubes, we label them as anti-A, anti-B, anti-D, and then first we add the anti-sera into these test tubes, followed by the 3% suspension of patients or individuals' red cells, and then we mix the tube contents. We then load the test tubes in the centrifuge and go for centrifugation. The centrifugation speed should be validated at each blood center, and they're usually 3000 rpm for 15 seconds or 1500 rpm for 1 minute, but they should be validated properly. And then after centrifugation, we should observe the reaction under a light source on an RHV box and then grade the reaction. Grading of test tube reaction can be from 4 plus to 0, and H means hemolysis. 4 plus, as you can see, means a single large agglutinate with clear background. 3 plus means several 2 to 3 large agglutinates with a clear background. 2 plus means medium size agglutinates with clear background, and 1 plus is a reaction in which there are several small agglutinates with turbid background. 0 means no reaction and therefore no agglutination, and H is a very positive reaction, is hemolysis, and if you see hemolysis, it should be considered as a positive reaction and recorded appropriately. In reverse grouping, we again label 3 tubes with A cells, B cells and O cells. We first add the patient's antisera in all the 3 tubes and then add already prepared 3% suspension of known A cells, B cells and O cells in respective tubes, centrifuge and observe the reaction. Also, during routine blood grouping, we have a practice to include an auto-control test tube in which we add the patient's sera and red cells, and this is just a screening method to find out any auto-reactivity in the patient sample. Moving on, next is the microplate method, which is again based on the hemagglutination principle. It is similar to tube agglutination, however, it is ideal for testing large number of blood samples, and therefore many blood tests can be done, immunohematological tests can be done on this assay, which can be blood grouping, antibody screening as well as cross match. As large number of samples can be processed and the throughput is high, it saves time, and also the interpretation, reading and printing of the results can be automated. So the microplate is usually a polystyrene plate with 96 wells having rows A to H of 12 wells each, and they can be either U-shaped or V-shaped with 200 to 300 microliter capacity. Again, depending on the classification of microplates, as I already told, they can be classified on the basis of shape U or V. U are the most preferred ones as interpretation is easier, and also the wells can be classified whether they are coated or empty wells. They are usually coated with right monoclonal antibodies, and this makes testing very easier, as if we already have the wells coated with NT, NTB and NTD, then forward grouping can be easily done. And these are this table shows the various formats in which microplates are available in the market. For forward grouping, they are already coated with the respective antisera, and we also have microplates for forward and reverse grouping. Also, there is third configuration in which they are coated with RH NCAL antibodies, and this can be used to do the respective phenotyping. The principle of microplate is again antigen antibody reaction resulting in hemagglutination or hemolysis. The forward grouping test antigen for red cells and reverse grouping test for antibodies in the serum. After centrifugation, the red cells settle at the bottom like in a tube. So this can be considered as a miniaturized version of a test tube. After they settle at the bottom, some shaking is done to resuspend so that the unagglutinated cell will will resuspend, and the agglutinous cell will not resuspend, they will remain at the bottom of the well. Positive reaction is visible again as agglutinous cells are settled at the bottom of the well. And this is how the configuration can be of a microvell plate. And going on to the interpretation, again this figure shows that a positive reaction will be a concentrated button of red blood cells, while a negative reaction will be a smooth suspension of red blood cells or a streaming pattern of red cells. Also, we can keep the microplates at room temperature for incubation and for 5 to 10 minutes for further to enhance the reaction. This is how it looks. This is a positive reaction and this is a negative reaction. Grading can take place as strong positive means 2 plus, complete agglutination, and which means 2 to 3 agglutinates assembled at the bottom of the well. Weak reaction is weak positive 1 plus, which is presence of small agglutinates in the bottom with numerous free cells in suspension, and negative means no visible agglutinates. The advantage of this testing methodology is that small volumes are required of and it is very much cost effective. Second thing is the operation time is drastically reduced. Both we can do 12 samples forward and reverse typing in one go. Then batching facility is always there, and this makes again quite operation quite economical. Plates already we have already discussed, the plates can be already coated with anti-sera, and which again minimizes time and work. And automation facilities available with microplate technology. This greatly reduces reading and transcription errors, saves staff time. Also, barcoding facilities available for positive sample identification. And then integration with computer system is there for storage of data. And also it minimizes the staff handling by automation, thereby reducing the exposure to bloodborne infections, viral infections. The disadvantage of this method is that when we resuspend the cell button, then there can be some loss of sensitivity. However, it is usually within acceptable limit, and this can be used by overcome by treating the red cells with enzyme. This will further enhance the sensitivity. Also, this technique requires the use of special centrifuge and agitator. And also, if we have any hemolysis in the test patient's red cells or individual red cells or the sample, or there is presence of H hemoglobin, bilirubin or lipids in the sera of the patient, then interpretation by the automatic reader will be affected. Techno-twin station is one of the automated methods for processing of microplates, and the centrifugation, agitation, reading and interpretation is all automated in this system. This is how the range of reaction looks. If you see the forward grouping, this is forward grouping in which with anti-A, it is a single 2 to 3 large agglutinates at the bottom of the well, which is a 2 plus reaction. With anti-B, it's a smooth suspension of cells, a negative reaction. Again, anti-AB reagent, it is a positive reaction. And anti-D is a negative reaction. This is a controlled well, followed by reverse grouping, in which with A cells it's a negative reaction, with B cells it's a positive reaction, and with O cells again negative reaction. And the final interpretation is A negative blood group, RHD negative. Next is column agglutination technology, which was invented by Dr. Lapierre in 1988 and initially distributed by DIMET. It actually consists of a specially designed microtubes, 6 microtubes fixed on a plastic card, which is approximately 5 to 7 centimeters. And its principle is size exclusion of agglutinated red cells in an inert matrix. I will explain this further in detail, but first let us discuss the structure of this microtube. Each microtube has an upper reaction chamber which is white, which allows the addition of the patient's red cells or plasma and also allows for incubation of the test mixture. This is followed by a long narrow portion which is known as the column, approximately 15 mm in length. So in this column is actually the gel or the matrix, which can be made of either gel or glass beads, and this gel matrix is actually coated with the reagents. So the column which contains the matrix, a long column, it can actually have matrix of different types. It can be a gelatin or a acrylamide gel or made up of glass beads. The glass bead gel is usually distributed by orthoclinical diagnostics, and acrylonitrile gel is nowadays distributed by Biorad. Now this matrix can contain media or the reagent, which may be a neutral containing buffer which is used for ABO reverse grouping, or it can have the anti-A, anti-B and anti-AB, or an anti-D for forward grouping. Principle is very simple. It's actually a column and it contains gel or glass beads with pre-dispensed reagents. So the reaction chamber will actually provide area for sensitization of RBCs with during incubation, and then as we centrifuge the card, the red cells will move through the gel, and the gel is coated with the anti-serum. So the gel is porous and it serves as a reaction medium. Any agglutinin, and if the RBCs react with the anti-sera in the gel, then agglutinates will be formed and they won't be able to pass down through the gel. Agglutinated cells will remain at the top while unagglutinated cells will go down unimpeded at the bottom of the microtube. So this is how we grade the reaction. It can be graded from 4 plus to a 1 plus and a negative reaction. 4 plus means all the agglutinated cells have settled at the top of the column and forming a layer at the top of the gel media, which is a clear 4 plus. However, if most of the cells are in the upper half of the column, as you can see in the figure, then it's a 3 plus reaction. And if the red cells are distributed throughout the column length, then it's a 2 plus reaction. And if most of the red cells are concentrated towards the lower half of the column, then it's a weak 1 plus reaction. A negative reaction is when there is no reaction has actually taken place, there is no antigen antibody reaction, and all the red cells after incubation in the upper reaction chamber, then during centrifugation, have actually gone down through the gel unimpeded and settled as a pellet at the bottom of the microtube. A mixed field reaction is when you get an agglutinated cell at the top of the gel and a pellet of unagglutinated cells at the bottom. We'll see the figures how mixed field reaction looks like. This is how it is. This in the first microtube in which you can see this is a grouping card, reverse grouping card. This well is actually coated with anti-A, and this you can see at the bottom is unagglutinated cells. At the top is a thin layer of agglutinated cells, followed by, if we see, this is with anti-B it's a negative reaction, with anti-D it's a positive reaction. Control is okay, it has passed control, and with A cells you can see it is again showing a mixed field reaction. That means this is a grouping discrepancy, and with B cells it is a clear-cut positive reaction. So this type of finding needs further evaluation. One of the most common reasons of mixed field reaction is a recent history of transfusion. So the gel technology is currently approved by FDA for doing ABO forward and reverse grouping, RS typing, direct antiglobulin test, antibody screening and identification, and also cross-match. So the gel for forward grouping will contain anti-A, anti-B, anti-D. For reverse grouping, it will contain only a neutral buffer, as already discussed. For RS typing, it will contain anti-D, and for further RS phenotyping of other RH antigens, it will contain anti-D, anti-capital C, small c, anti-capital E, and small e. And for detecting of alloantibodies, it will contain anti-IgG. The advantages of gel technology is many. It provides a very stable, well-defined endpoint of agglutination. It's very clear what is a 4 plus, 3 plus, and 2 plus. It is very simple to standardize this procedure. No washing is required, and also the results are very much objective. They can be stored for up to 3 days, and we get reproducibility is very good in this platform. Also, the volume of sample required is much less, and again, gel technology has the facility for automation. The disadvantage again, as with was a microplate technology, this gel technology also requires special incubator, centrifuge, and micropipette, and they have a higher cost as compared to test tube and slide method. Automated method. This IH1000 offered by Biorad is one of the automation methods, automated machine which offers complete blood grouping for patient samples. We next move on to solid phase technology, which was first applied by Rosenfield in 1978 for RBC typing and antibody screening. and then again further used by Plapp and co-workers for detection of RBC antigens and antibodies in 1984. Currently, solid phase immunoassays are available for detection of antibodies to RBCs, platelets, and infectious agents like syphilis and cytomegalovirus. In immunohematology, the principle of solid phase assays is that the antigen or antibody which is being studied is first immobilized on a solid matrix. This is in contrast to gel and microplate method and even tube method where the reaction occurs in a solution or in a suspension. Here the reaction occurs in a solid phase and the antigen antibody is already immobilized. And then the analyte which we want to detect is incubated in that solid phase and the adherence of the analyte to the solid phase is measured. I will explain this for the slide. So the test principle and procedure is, suppose if we want to do reverse grouping, the well is coated with antigen like A cells, B cells or O cells, and then we add patients or individuals plasma serum along with list. We allow the incubation so that the antibodies in the patient's plasma can bind to the antigen coated wells, and then we do a washing step and add the indicator red cells. Now these indicator red cells are actually coated with anti-IgG. If the antibody has from the patient's plasma has bound to the antigen, then this anti-IgG coated indicator red cells will bind to the antibodies in the patient's plasma which are bound to the antigen, and therefore a monolayer will be formed along the solid phase matrix if it's a positive reaction, and will get a smooth suspension which is a strong positive reaction. However, if there is no antibody in the patient's plasma which is bound to the coated antigen coated wells like the A cells, if there is no anti-A in the patient's plasma, then all the indicator red cells will settle at the bottom of the well as a single solid pellet, and this will be a negative reaction. So a 4 plus in a solid phase technology, which is also known as a capture assay, will be a smooth suspension spread throughout the well, and it is a 4 plus reaction. This is in contrast to hemagglutination method, which is in tube, or a microplate method with a single solid pellet at the center is a positive 4 plus reaction. And a negative reaction in this case will be a single solid pellet. In case of solid phase technology will be a single solid pellet at the bottom of the tube. As you can see, this is a little bit fragmented pellet, and therefore it's a 1 plus reaction, a weak reaction. If it's a very clear pellet at the bottom, it's a negative reaction. For forward grouping, we can actually coat the wells with an antibody like anti-A, anti-B, and anti-D, and then incubate the red cells of the patient with them. And following that, if binding occurs, again it will bind throughout the well and it will be a smooth suspension. It's a positive reaction. However, if there is no antigen on the red cells, concerned antigen against which the well antibody is being coated on the well, then it's a negative reaction. So again, to look at the interpretation, this is the top view, this is a side view. The side view will be the indicator red cells in case of reverse grouping, or forward grouping in case of patient red cell directly. They will be spread throughout along the well, and this will look as a smooth suspension. However, if they spread on some portion of the well and not throughout the well, it will be a weak positive reaction, and then it will look like some cells have started to come together in the center but not have actually formed a very strong clump. And a negative reaction will be a strong single cell button at the bottom of the well, and this is how it will look. The advantages of solid phase technology is that it's very easy to standardize, no pre-dilution of reagents is required, and there is no resuspension or shaking step as we have seen in microplate method. It has very increased sensitivity, and it's, again, automation is available, and it is even possible to test hemolyzed lipoichoric sample, which was a disadvantage for the microplate method because it needed automatic interpretation through it needed interpretation through an automatic reader, and also it can help you detect weak antibodies and antigens. But the disadvantage is, again, there is a need of a special centrifugation device. It needs light source for reading the reaction in the small solid phase wells, and sometimes it can detect weak antibody that is missed by other systems, may cause confusion. Because it has high sensitivity, It can detect even weak antibodies and create some confusion in final interpretation. The last technology which we will be discussing will be erythromagnetic technology, which is based on principle of magnetization of RBCs using paramagnetic particles that are adsorbed further onto the surface of RBCs. In this, the sample RBCs are mixed with a magnetizing solution of iron chloride and bromelain. Bromelain is an enzyme which will further enhance the reactivity of the RBC antigen towards the antiserum. This cell suspension is then dispensed in a microplate well which is already coated with pre-dried antiserum. Once antibodies in antisera react with antigen on the RBC surface in that well, the magnetic force is applied from the bottom at the bottom of the microplate. If antigen-antibody reaction has taken place, then the agglutinated RBC are pulled to the bottom of the microplate. Here the simple thing is that instead of centrifugation, the magnetic force has replaced the centrifugation step, and therefore once after magnetic force has been applied and the agglutinated RBCs have come to the bottom of the microplate, then even after we shake using an agitator, the free cells are resuspended, but the agglutinated cells will remain at the bottom of the well. This technology has again been used to do forward and reverse grouping as well as antibody screening and identification. With this, we complete the various serological techniques used for blood grouping. The main issue with serological method is that it cannot precisely indicate RST zygosity, and they are not reliable in recently transfused individuals. For this, we need to do molecular typing, which will actually detect the which will actually reveal the true blood group of the individual. Comparison of various blood grouping techniques. If we look at this table, the slide and the tube method, microplate and column method all follow the principle of agglutination. Slide is a very simple method for only blood group detection, only forward grouping, whereas tube can be used for blood grouping as well as antibody screening and identification. Similarly, microplate is also for grouping and antibody screening, and column gel technology as well. The time taken for slide method is usually not less than more than 10 minutes, usually 5 to 10 minutes we can do the procedure. Similarly, for tube method, depending on the number of samples, it can range from 10 to 30 minutes. Microplate is again, the throughput is very high, so large number of samples can be finished within 10 to 30 minutes. And similarly for column, if it's an automated or manual technology, we can do both, but it usually takes 10 to 45 minutes depending on the sample load for grouping. Now, applicability of these techniques is everywhere in hospitals and clinical laboratories. The slide method is least sensitive but has very low cost, requires small volume, and usually, as I have already discussed, for rapid results in emergency trauma patients or for outdoor camps. Tube has higher sensitivity, and again the cost is very low. It's a gold standard method. Microplate is very high throughput, highly sensitive. Similarly, columns agglutination technology is also highly sensitive. For blood grouping, it is less time consuming, but for antibody screening and identification, this requires a lot. It can require 45 minutes. And with this, I have finished the simple presentation of various serological techniques, and I would like to thank you all for your patient listening. If there are any queries, I would be happy to entertain. You can mail me your queries at my email ID, which is mittalsaid101@gmail.com. Thank you.